I'm AnaMaria Garza. I'm a colorectal and general surgeon here at Glendale Memorial Hospital. What people should know about colon cancer is that it's a very preventable disease. It's one of the only diseases that we can catch a polyp early and actually prevent the cancer from forming. A lot of the other screening just finds the cancer, whereas we actually find the polyps before it turns into a cancer, so we can actually prevent the cancers from coming. People tend to think that colon cancer affects only men, but it actually affects women as well. So it's about 50-50 for men and women, so it affects both genders equally. Women a lot of times can have rectal bleeding, and they associate it with some type of hormone changes, or it's just that time in their life, when in fact they could have a real problem. So it's very important that they get screened at the age of 50 or early, depending on their risk factors. There's a group of patients who actually can get colon cancer before the screening age of 50. So it's really important that if patients have symptoms or have family history of colon cancers, breast cancers, or endometrial cancers, that they see their doctor to get a colonoscopy much earlier than recommended. Sometimes when the cancer gets more advanced, you could have bleeding or changes in your bowel habits, but actually the most early cancers don't have any signs or symptoms. So that's why a colonoscopy is very important, because it'll catch it before you actually develop symptoms. Colon cancer is not due to poor diet. There are certain things in your diet that can decrease your risk of colon cancer, like increasing the fiber in your diet, decreasing the red meat, decreasing the amount of alcohol you take. But a poor diet doesn't necessarily mean you're going to get a colon cancer. Well, colon cancer survival is really based on stage. So the earlier that we diagnose it, the better survival rates you have. Now, we have really good chemotherapy agents now that can treat very advanced tumors and actually make them all go away. So even if the cancer's much more advanced, we can still cure patients. Colostomy means a bag that either can be permanent or temporarily affixed to the skin, where the stool passes into the bag. Sometimes when we do surgeries and patients have advanced cancer or extensive treatment, we may need to do a temporary bag, and for about 6 weeks, and then we'll reverse it. Other patients, which is very rare, which is less than 1%, need a permanent bag. Women with colon cancer do not have an increased risk of incontinence. Continence is usually based on how low the tumor is and how much of the rectum we need to take out, as well as if a patient has radiation. But we can do a lot with medications to try to give the patient better control of their bowel movements. So incontinence really isn't a big factor for women. It's the same as for women and men. The colorectal cancer screening can be one of the most important things you can do for your health. It's one of the most preventable cancers, and it's a disease that if you do the colonoscopy and remove the polyp before it turns into a cancer, you can change the rest of your life.